Gentlemen, I want to ask you something that might make you pause. When was the last time you woke up with a strong, confident morning erection? The kind that reminded you, without a doubt, that your body still works, that you're fully capable, and still alive in every sense of the word. If that memory feels distant, or worse if it's been months or even years, then what I'm about to share could completely change everything for you. It sounds almost too simple, but the solution is already sitting in your kitchen. 2 common ingredients, extra virgin olive oil and baking soda, when combined and applied correctly, can restore blood flow to your penis and awaken your little guy in as little as 24 to 48 hours. I'm Dr. Mika Hayashi, a board-certified urologist, and for over a decade, I've been helping men reclaim their vitality. Today, I'm going to show you exactly why this works, the precise method to do it safely, and what results you can realistically expect. But here's the crucial part. Your blood vessels are shrinking as we speak, and every day you wait makes recovery harder. Stay with me until the end, because by the time we're done, you'll have everything you need to take action tonight. Before diving into the method, let's understand what's really happening inside your body. The weakening of your erections isn't about age or masculinity, it's about circulation. Inside your penis are microscopic arteries, thinner than a grain of salt, responsible for rushing blood into the erectile tissue. When you were younger, they opened instantly, flooding the tissue and creating strong, reliable erections. Over the years, though, stress, inflammation, high blood pressure medications, elevated blood sugar, and processed foods gradually narrow and stiffen these arteries. The smooth muscles surrounding them lose responsiveness. Even when desire is present, blood simply can't reach the tissue fast enough. I know the toll this takes: the quiet frustration during intimacy, the growing distance in your relationship, the confidence that slowly erodes. I've sat with men in their 60s and 70s who have survived wars and built empires, and this one issue brought them to their knees. Here's the truth most doctors won't tell you. This is not permanent. Blood flow can be restored. Arteries can reopen. Tissue can awaken again. And you don't need risky surgeries, expensive treatments, or lifelong reliance on pills with harsh side effects. What it takes is understanding your body and giving it the right tools to heal itself. This isn't some internet myth. It's grounded in science and over a decade of clinical experience. A 2019 study published in Nutrients found that polyphenols in extra virgin olive oil significantly improve endothelial function, the inner lining of blood vessels that produces nitric oxide. Nitric oxide is the master signal telling arteries to relax and expand, letting blood surge into erectile tissue. Harvard Medical School research shows men who consume olive oil regularly experience up to 30% better erectile function than those who don't. Now, let's start with the most powerful ingredient most men already have in their kitchen. Extra virgin olive oil is more than a salad dressing, it's a natural tool for restoring erectile function. And once you understand what happens at the cellular level, you'll see why. Olive oil contains polyphenols, specifically hydroxytyrosol and oleuropein. These compounds repair the delicate inner lining of your arteries, the endothelium, which acts as the control center for blood flow. When healthy, it produces nitric oxide, signaling arteries to open wide and let blood rush through. But damage from stress, poor diet, inflammation, or medication reduces nitric oxide production, narrows vessels, and weakens erections. This is where olive oil steps in. Its polyphenols repair the endothelium, reduce oxidative stress, calm inflammation, and restore nitric oxide production. Think of it like reopening highways that have been blocked for years. Blood can finally flow freely again. And here's a fact that surprises most men. This is the same biological pathway that Viagra targets. Viagra temporarily keeps nitric oxide active, allowing blood vessels to stay open. Olive oil, on the other hand, helps your body produce nitric oxide naturally. One is a short-term chemical fix. The other is a long-term repair, giving your body the foundation to function like it did years ago. But olive oil doesn't stop there. It also stabilizes testosterone by reducing systemic inflammation. Chronic inflammation stresses the Leydig cells in your testicles, the very cells that produce testosterone. By calming inflammation, olive oil helps your body maintain healthier testosterone levels naturally. Higher testosterone means more desire, more energy, and more drive, all the things that make you feel like yourself again. Quality matters. Not all olive oils are equal. You need extra virgin, cold-pressed, stored in a dark glass bottle, with a harvest date within the last 12 months. Freshness is crucial, because polyphenols degrade over time. Brands I recommend include California Olive Ranch, Kirkland's Signature Organic, and Calavita. They're widely available, affordable, and tested for quality. When you open the bottle, it should smell fresh, grassy, or slightly peppery. If it smells stale or like crayons, throw it out. Olive oil alone is powerful, but combine it with one unexpected ingredient, and results can happen far faster. That ingredient is probably sitting in your pantry right now. Baking soda. I know what you're thinking. Baking soda? Really? The same stuff used for baking or cleaning? Yes, sodium bicarbonate. The chemical name neutralizes acidity, calms inflammation, and relaxes smooth muscle tissue, all critical for restoring erectile function. Here's what happens inside your body: chronic stress, poor diet, lack of sleep, medications, and aging create an acidic, inflammatory environment in your tissues. That acidity doesn't just affect joints or stomach, it affects the smooth muscles surrounding the tiny arteries in your penis. Inflamed and contracted muscles act like pinched hoses. No matter how much pressure you apply, blood can't flow properly. Baking soda neutralizes acidity, soothes inflammation, and relaxes those muscles. When combined with olive oil, something remarkable happens. The oil acts as a carrier, allowing the baking soda to penetrate deeper into tissue. Olive oil repairs endothelial lining and boosts nitric oxide from within. You get two mechanisms working together, opening vessels from inside while relaxing muscles from outside. Blood surges where it should, and men often feel warmth, tingling, and pulsing almost immediately. Some men feel results the first time. Others need a few sessions before tissue responds. Consistency is key. 3 to 4 times per week leads to stronger, more reliable erections, increased sensitivity, and improved blood flow. You're not forcing your body to do something unnatural. You're clearing the path and letting it function the way it was designed to. Next, I'm going to walk you step by step through the exact preparation and application methods so you can start tonight. But before that, I need to make sure you understand the small details that make this safe and effective, because applying it incorrectly can cause harm. Alright, gentlemen, now that you understand why olive oil and baking soda work, let's break down the exact step-by-step method so you can start tonight and see results as soon as your body responds. Precision matters here. This isn't complicated, but the little details make all the difference. Step 1. Gather your ingredients. You need just 2 things. First, 1 teaspoon of extra virgin olive oil. Make sure it's cold-pressed, fresh, and stored in a dark glass bottle. Brands, I recommend California Olive Ranch, Kirkland's Signature Organic, or Calavita are widely available and tested for quality. Second, 1/4 teaspoon of baking soda. Look for pure sodium bicarbonate, preferably aluminum-free. Arm & Hammer or Bob's Red Mill work perfectly. Chances are, you already have this in your kitchen. Step 2. Prepare the mixture. In a small bowl, combine the olive oil and baking soda, stirring until it forms a smooth, creamy paste. The consistency should be like a thick lotion, not runny, not clumpy. If too thick, add a few drops of olive oil. If too thin, a tiny pinch more baking soda. Some men like to warm the mixture slightly by rubbing it between their palms, optional, but it can enhance comfort and absorption. Step 3. Prep the area. Wash thoroughly with warm water and mild, unscented soap. Rinse completely and pat dry with a clean towel. Clean, dry skin ensures maximum absorption and prevents any barrier between the mixture and your tissue. Step 4. Apply the paste. Using clean fingers, start at the base of the shaft and work upward toward the head, massaging gently in circular motions. Focus on the underside. where nerve pathways are most concentrated. Don't rush this. Take 2 to 3 minutes to massage evenly. You're not just rubbing a mixture on, you're activating tissue, awakening nerves, and stimulating blood flow. Step 5. Let it sit. Leave the paste on for 10-15 minutes. Sit back, relax, and notice any warmth, tingling, or gentle pulsing. These sensations indicate blood is moving. If you don't feel anything immediately, don't worry, sensitivity varies, and the effects build over time. Step 6. Rinse and dry. Use comfortably warm water to wash off the mixture, then gently pat dry. Avoid rubbing aggressively. The tissue is delicate, and you want to treat it with care. Step 7. Frequency and timing. For best results, apply this method 3 to 4 times per week. Monday, Wednesday, Friday, and Sunday works well, but any consistent schedule is fine. Evening application, 30-60 minutes before bed, is ideal. Why? Testosterone peaks during deep sleep, giving your body the perfect environment to repair itself naturally. Now, you might be wondering, how fast will I see results? The answer depends on your body, age, health, medications, and how long you've been struggling. Some men notice warmth or tingling immediately, and even wake up with a partial or full morning erection in the first 24 hours. Most, however, need several sessions before the tissue becomes responsive. Between days 2 and 7, blood flow awareness increases, sensitivity improves, and partial morning erections often return. By weeks 2 to 4, most men experience noticeable changes. Erections become firmer, stronger, and more reliable. Sensation sharpens, morning erections become more frequent, and confidence begins to rebuild. One patient described it as finally being able to exhale after holding his breath for years. Relief, hope, and a sense of reclaiming himself start to emerge. By the 2 to 3 month mark, men who've been consistent report strong, dependable erections, and renewed intimacy. Sexual experiences shift from anxiety and fear to connection and desire. Relationships improve because partners feel wanted again. The shame and frustration that once dominated interactions fade, replaced with confidence and vitality. Some men even report emotional transformation, feeling more present, energetic, and alive. But let's be honest, not everyone will experience the same timeline. Some notice dramatic changes in the first week, others need a full month. Age, overall health, and consistency are all critical. Attempting this once and giving up won't yield results, but committing 3 to 4 times per week for a month gives your body a real chance to heal. Safety is just as important as effectiveness. There are specific situations where this method should be avoided. First, any open wounds, rashes, irritation, or broken skin on the penis. Wait until fully healed before applying. Baking soda can burn damaged tissue. Second, men with sensitive skin or allergies should perform a patch test on the forearm first. If redness, swelling, or itching occurs, do not use this mixture. Third, if you're taking nitrate medications like nitroglycerin or isosorbide, you must consult your doctor. Both the mixture and nitrates dilate blood vessels. Combined, they can dangerously lower blood pressure, leading to dizziness, fainting, or worse. Fourth, active infections, such as urinary tract or sexually transmitted infections, must be fully resolved before using this method. Watch for warning signs during application. Mild warmth and tingling are normal, but severe burning, pain, intense redness, or swelling are not. Rinse immediately if these occur. Sudden erectile dysfunction accompanied by chest pain, shortness of breath, or extreme fatigue requires immediate medical attention, as it may signal cardiovascular issues. Your safety always comes first. Let me share a real-life example of what's possible. A few months ago, a 71-year-old man, let's call him Robert, walked into my office. He had been married for 40 years, retired as a contractor, and hadn't had an erection in over 3 years. Medications failed, and doctors told him, it's just age. But lying next to his wife each night, he felt like he was failing her. and the silence between them had become suffocating. We started the exact method I've outlined. 1 teaspoon of olive oil, 1/4 teaspoon baking soda, 3 times per week before bed. Week 1 brought warmth and tingling but no erection. He almost gave up, but consistency mattered. By week 2, he woke with a partial erection, the first in over 2 years. By week 3, full morning erections returned. By the end of the month, he and his wife were intimate again. Robert's transformation was remarkable. He said, "I didn't think it was possible at 71, but I got myself back." And his wife told him she hadn't realized how much she'd missed him until he was fully present again. This isn't just about erections, it's about reclaiming identity, intimacy, and confidence. If a 71-year-old man who had tried everything could restore function in less than a month, imagine what's possible for you. And if you found this information helpful, do me a favor. Subscribe to this channel and hit the notification bell. I create content specifically for men over 50 who refuse to accept decline as inevitable. Type yes in the comments if you're going to try this tonight, along with your age and how long you've been struggling. Let's support each other, you're not alone. Now that you've seen Robert's transformation, let's talk about what happens when you follow this method consistently. One of the most important concepts to understand is that your body is relearning how to function naturally. This isn't about forcing it to perform artificially, it's about clearing the obstacles that have been holding you back for years. Over time, the arteries open more easily, the erectile tissue becomes more responsive, and the smooth muscles relax as they were designed to. In the first few applications, sensations like warmth, tingling, or slight fullness are your body responding. Some men notice dramatic changes immediately, while others take a week or two. The key is patience and consistency. Just like training any part of your body, the tissue and nerves need repeated stimulation to rebuild strength and function. When applied 3 to 4 times per week, most men experience progressive improvements in both blood flow and sensitivity. By the second week, many notice partial morning erections returning. There's a subtle difference in how the tissue feels: more alive, more responsive to touch, more engaged with arousal. This is an early sign that the arteries are opening and blood flow is improving. Some men even feel more energetic and confident as their hormone levels begin to stabilize. Weeks 3 to 4 are transformative for most men. Erections become noticeably stronger, firmer, and more reliable. Morning erections increase in frequency, and sensitivity improves significantly. Men often describe it as their body waking up after years of dormancy. The psychological impact is just as profound. Confidence returns, intimacy becomes enjoyable rather than stressful, and the fear of underperformance starts to disappear. Beyond the physical effects, this method strengthens the mind-body connection. Men report feeling more present during intimacy, more connected to their partner, and more in tune with their own desires. Sexual activity is no longer a source of anxiety, but an experience of connection and fulfillment. Relationships improve, communication deepens, and the emotional distance that once existed starts to close. Some men even notice improvements in other areas of life. Energy levels rise, motivation increases, and the overall sense of well-being strengthens. Testosterone stabilization plays a significant role in this transformation, enhancing mood, drive, and vitality. The body starts functioning as it was designed, and the mind follows. Of course, results vary. Age, lifestyle, diet, stress levels, and prior health conditions all influence the timeline. Some men see dramatic results in the first week. Others may need a full month to notice significant improvements. Consistency is the single most important factor. Skipping sessions or giving up early will prevent the body from reaching its full potential. Now, let's address safety and common questions. While this method is natural, not everyone should apply it without caution. Open wounds, rashes, or irritation must heal first. If you have sensitive skin, perform a patch test on your forearm, and wait 15-20 minutes to check for reactions. Allergies to olive oil or sodium bicarbonate make this method unsuitable. If you're on nitrate medications or have active infections, consult your doctor before use. Pay attention to your body. Warmth, tingling, or slight pulsing is normal, but severe burning, pain, or swelling is not. Stop immediately and rinse if these occur. When done correctly, the benefits compound. Men who stick to a consistent schedule 3 to 4 times per week often see remarkable improvements within a month. Erections become stronger, sensitivity improves, and intimacy becomes enjoyable again. Confidence grows, relationships strengthen, and the shame and frustration that once dominated sexual experiences fade. Remember, this isn't a quick fix, it's a natural restoration process. Olive oil repairs the endothelium, baking soda relaxes smooth muscles, and together they allow blood to flow freely. Nitric oxide production increases, arteries open, and erectile tissue responds. Over weeks, your body learns to function as it once did, naturally and reliably. Real-life stories prove the results. Men in their 60s, 70s, and beyond who had lost hope are now experiencing full morning erections, renewed intimacy, and emotional reconnection with their partners. It's not just about sex, it's about reclaiming identity, confidence, and connection. You deserve to feel like yourself again. So, here's the final takeaway. Consistency, quality ingredients, and proper application are the keys to success. Use fresh, high-quality extra virgin olive oil, pure baking soda, and follow the steps carefully. Apply the mixture 3 to 4 times per week, preferably before bed, and give your body the time it needs to respond. If you're ready to reclaim your vitality, start tonight. Take control of your blood flow, restore natural erectile function, and rebuild confidence. This is your chance to wake up feeling alive, capable, and fully present once more. If you found this video helpful, subscribe to this channel and hit the notification bell so you never miss content designed for men over 50 who refuse to accept decline as inevitable. Type yes in the comments if you're going to try this tonight. Share your age and how long you've been struggling. Let's support each other. You're not alone. This is your moment. Take action. Reclaim your body, your confidence, and your connection starting today.